Hey everybody, this is the Ben and Gary show. We know dentistry, and welcome back. We had a question from a patient who asked something that I think should have been asked a long time ago, but we've just never discussed it, and that is, why do I have bad breath? And there can be various causes, but I think one of the most common causes is probably periodontal disease or gum disease, and so we should probably talk about that first, and then go into other areas.
Aspects, yeah.
Yeah, and so when you have periodontal disease, you generally have deeper pockets, and it's rather difficult to clean those pockets because the depth of the pockets, or the depth of the attachment of the gums to the tooth is kind of far down below the gum line, and it's very difficult to get into those areas. So, consequently, of course, we have very skilled hygienists who can do the cleanings that go below the gum tissue, and that helps a lot.
Mm-hmm.
But some people that don't come in for regular cleanings can have some issues there, and that's where you get a lot of plaque that accumulates and deposits.
A lot of tartar buildup.
Mm-hmm. So, but as a result of that, you can have a lot of different types of odor coming from those pockets, and as a consequence, you can have bad breath from that.
The bad breath won't resolve until that gets treated,
Right.
taken care of.
So besides that, what are some of the other reasons, Dan, that you think patients can have bad breath?
Well, the one I was thinking came to mind
Mm-hmm.
is dry mouth, because when
Mm-hmm.
the patient doesn't have a lot of saliva, the saliva can kind of help wash out a lot of the extra bacteria too.
Right.
So that can contribute to getting bad breath.
Yeah. So also when you're out exercising, I guess that can cause the dryness to become a little bit more accentuated, and you can also have that contribute to the malodor. But I don't know if you've ever been in an airplane and someone's been sitting in your vicinity, and sometimes you can smell the odor from the gum disease and all, but it's a distinct odor. And so, as a dentist, I guess we would recognize it
a little bit more familiar.
Yeah,
with that.
right. So we notice those things a little bit more often. And my wife is a dental hygienist, and on top of that, she has a very keen sense of smell. So that's when I get the can you smell it? It's like someone's got periodontal disease here, But oh my gosh. But anyway, so.
Yeah.
But with periodontal disease, there's also some links to systemic conditions, such as heart disease and diabetes. And so those are other reasons that we should have these periodontal patients come in on a little bit more frequent interval, like every 3 months rather than every 6 months, for people that don't have periodontal disease. But anything else that we?
Yeah, just a little bit harder to maintain.
Yeah.
So it's more important that they see us more regularly.
Yeah.
I guess the different aspects of breath itself, in terms of you can diagnose other diseases just from what comes out of your breath.
Right.
And the smells can be different coming out of the breath. So they have specific tests where they can measure the levels of things.
Oh, okay.
You can't just do it from sniffing their bad breath. But they can measure not necessarily just the oxygen output, but other things that are in your breath, like acetone and things like that.
Okay, so they would see a physician for that?
Yeah, it'd be a physician, visit.
Would it be like an ENT? Or?
I'm not sure, actually.
Yeah.
But definitely somebody that can address the levels and see the levels of these things.
Right. So what are some of the things that we do to combat that is, mouth rinses. So Listerine has a product now, but Listerine in general has a bit of alcohol in the mouth rinse, And then now they've come out with some alcohol-free variations. So that, I think that's helpful too, because alcohol by itself will tend to dry out your mouth, right? So,
right.
But so
I think alcohol just is known to be kind of like an antiseptic kind of thing, so that's probably why they kept it in there just historically.
Right. Yeah.
But nowadays we have a lot of different kinds of antiseptic materials.
Right.
So that maybe people don't want that in their mouthwash anymore.
Right. Right. So I think again we've kind of come to the conclusion of the bad breath subject here, but. This has been another episode of the Ben and Gary Show, and of course we have Dan Pinto here, who's joined us. And keep those questions coming in, and we'll be happy to answer them. So you guys have a good weekend. Take care.
Have a good one.